Hey, how are you?
Good. How are you doing?
I'm good. Happy Friday.
Happy Friday to you. You look beautiful.
You do too. Thank you. So, is that a red lip? Are we giving a red lip today? I didn't know. You could have told me. Well, welcome. I'm so excited to have yours. Definitely want to just give you the floor immediately so you can introduce yourself and, of course, your brand. We can just hop right in because we have a lot of ladies who are either already mommies, they're planning on it soon, or they're currently expecting like me. So we have so much to talk about. I'm gonna give you the floor. Go ahead.
That sounds great. Thank you so much. Hello, everyone. My name is Rose Horton, and I am a nurse by education, training, and passion. And I have worked my entire career with the birth community. So I'm super excited to be here and to be with Shay, who looks gorgeous. Um,
Thank you.
and just about the importance of surrounding yourself with a village during your pregnancy. Pregnancy can feel like an isolated time, a time when you're by yourself and no one knows what you're going through. And the truth of the matter is, a lot of people do know what you're going through. You just need to surround yourself with folks and also be vulnerable enough to ask for help and say, hey, I need some resources. I need help with this, and be willing to accept that. It's super important for us not to silo ourselves and to go the journey alone when we can have a village. Historically, in the Black families, had extended family members who were there with us. You know, you had your grandma and your aunties and your cousin. It was the way we roll, but you know, as the generations have um, transpired, we're more distanced from family and we don't have that. So I just want to do a shout out that village is important, your entourage, people are important, and welcome in the journey.
Absolutely. I think that is very powerful what you just said. The transition from how it was back in the day. Like I would talk to my mom all the time, how she could walk down the street to see her mom, her grandmother, her aunties. But nowadays, especially with our generation, we're all over. Like we get up and go, we leave. And a lot of us, like myself and my husband, we're hours away, thousands and thousands of miles away from our family. So I'm definitely excited to learn about the resources that Antonia and Grace offers for someone like me and others who just don't have that close knit village and are currently relying on FaceTime because that's how I talk to my village. So,
Right.
what are some of the resources that you all offer?
Well, let me tell you a little bit about Antonia and Grace. I created the program, the company, from a Black woman for Black birthing people because
Yeah.
of the current reality that Black birthing people are facing. And I wanted to be a resource for them. So created for us, that's the whole intention. So what we offer is that network of support. I think it's really important during pregnancy to have someone help you navigate pregnancy because we know healthcare is complicated.
Yes.
And find their way through. I work there and I find it complicated. So I did a program where it's a nurse as a navigator that interfaces with you, plus a doula, plus a lactation consultant. So it's like the trifecta, right? You have all these people that are here just for you. And the goal is that we engage with you early in your pregnancy and we have touch points at significant milestones in your pregnancy just to make sure that everything's okay. Like it's your first trimester, how are you feeling? Yeah, it's normal to be tired, it's normal to be nauseated. Let's give you some resources to help you. It's your second trimester. How are you feeling? Let me show you the size of your baby now. Have you done this, this, and this? So our goal is to provide that support. And then when you get close to your third trimester, we introduce you to a doula. And the doula, you meet with her before you go into labor, and she'll do labor support for you, with you and your partner to help you prepare for labor. And then she'll meet you at the hospital, at the birth center, or at home, wherever you choose to have you,
Yes.
and be with you throughout your labor. And then she'll visit you a couple of times after you have the baby. And then last but not least, a lactation consultant. If you have decided that you want to do breastfeeding or chest feeding, we have a lactation consultant who will also meet with you before pregnancy, and we'll meet with you at the place of birth, and then we'll visit a couple of times at home. Because for a lot of moms who are breastfeeding, who are nursing, the tricky time is usually when you're at home. You're exhausted. You know, everyone coming to your room and checking in on you. So we thought it was really important to make sure you have that resource at home. So at a glance, that's what we offer. We think pregnancy, labor, and birth is a normal physiologic event. So let's provide holistic support. You know, it's not a disease that needs intervention.
Yeah.
Your body knows what it's doing. Let's go ahead and prepare your body for this amazing experience. And the final thing that I would say is that layered on top of this amazing resource is that we created classes. Again, by us, for us. We have one class we're calling Colonialism and the Black Birth Experience, where we really talk about the historical perspective of Black birth, and why it's influencing some of the decisions we make today. And we have a class called Breastfeeding While Black, because again, we have historical content to talk about breastfeeding and why some people really struggle with it, and maybe not even be aware of the feelings and emotions that they have around breastfeeding. So it's everything in a nice little bow, all created for you to make sure that your pregnancy journey is as supported, as informed, and as special as you'd like it to be. Our tagline is that it should be sacred and joyful. And so we work to the end.
I love that. I love that. And I think just thinking back to the time, like when I first found out I was pregnant, um, I couldn't help but think about all of my friends' experiences. Like so many of them, they went through emergency C-sections, and they struggle with breastfeeding. And I think out of all my friends that have had kids, only one I could think of actually had a doula. And I think that it's important for us to dismantle this myth that like, oh, you only need a doula if you have a midwife, if you're going to give birth at home. Because that's what I used to think, right?
Right.
And I think it's so important to have that emotional support. And I'm so thankful that my husband and I found an amazing doula. But there's so much more work to be done in our community, because a lot of women don't realize you can have a doula no matter where you're giving birth. So I would love to hear your perspective on that. And just, again, the different experiences that you've seen where, you know, women have come to you and maybe they weren't aware of what a doula support looks like, and just take a little bit of a deeper dive on that, because that's what I'm really focusing on right now, trying to get the word out. Like, you need a doula, you need a doula, everybody needs a doula. So I love to hear your perspective.
Doula. Yeah, I think doulas are amazing. It was really vitally, critically important for us to offer that service for us. And I think you said all the right things. The doula is your labor support person. So wherever labor occurs, it doesn't matter. You're going to be in labor and you
Yeah.
need labor support. Another myth is, oh, I'm planning on having an epidural. Great, that's fantastic. You don't need a doula just for an unmedicated birth. So
Mm.
doula is there for you for labor support, regardless of how you plan to manage your pain. I think that's an important distinction to get out there. I love doulas. I love midwives. I love everything centers around normal physiologic birth. So the doula will offer service. Let me tell you, at my hospital, my full-time job, we love partnering with the doulas, and we have even had go into the operating room with our patients. Not every hospital does that.
Yeah, they sure don't. Wow, that's amazing.
So what we do is after the patient is completely prepped and raped so that nothing can be seen, they can come and sit right there at the head of the bed, right by your partner, and be there for you also, because you guys have established a relationship over a couple of months. So
Yes.
to say, oh, now I'm going to the operating room and I can't be with my doula. It is my hope that all healthcare organizations will do that, but it is something that you can absolutely ask about. And if they can't be in the operating room with you, they can definitely come and see you in the recovery room and check in on you and check in on your baby, make sure everything's okay. And last but not least, they can absolutely go up to mother baby with you after you leave the recovery room, so that they can be there with you and help you as you get settled into this new routine of bonding with your baby and doing all the wonderful things. So doulas are great. I
Yeah.
think Black women especially need a doula. They need
Yeah.
it because sometimes they need someone to help amplify their voice. It's wonderful partner is there, but sometimes your partner may feel overwhelmed, and to have a second person to be able to say, no, this is really what we had planned for in labor, and we'd really like to see that come to fruition. So doulas are vitally important, and I'm full support, and I love them. So
Yes. And we have a question here. I want to make sure I'm honoring that. Joy Bell, she said, can a doula offer medical intervention in the event of a non-hospital birth, or must a midwife be planned for as well? So to my knowledge, you can correct me if I'm wrong, when you are planning a home birth or birthing center, you will need a certified midwife. The doula is more so there for your emotional support, pain management through your labor, and not actually going to be delivering your baby. But you can definitely hop in and let us know more, because I don't work here. This is just what I learned from my doula, but you're an expert, so you can answer her.
yes, and you are spot on, Shay. You're absolutely correct. So the doula is not a clinical personnel. Okay. Their focus is strictly on labor support. Again, whether it's physical support with pressure, counter pressure, giving you amazing foot rubs and helping you in positions to squat so that the pelvis opens. That's all in the purview of the doula. And that's why I really created Antonia and Grace the way that I did, because I know oftentimes doulas are pulled out of their scope of practice, out of their area of specialty and comfort. So
Mm-hmm.
I said, let's have a nurse as a clinician who understands all of the medical terminology and can function as a clinician and advise as a clinician. And then the doula could be really focused on what they really do best, which is labor support, and be that, again, that compass and that support and that nurturer for you when you're in labor. So
Absolutely.
nothing clinical, no catching the baby. That's all a midwife.
Yeah, and if you're lucky, like my husband and I were super blessed, because our doula actually used to be the head OB nurse where I'm delivering. So it worked out super great because she already knows the staff, and she's super knowledgeable because obviously, she was a nurse.
Right.
And she actually just came over and did some home visits. So I want to talk a little bit about that. If ladies, I will hope that you all will get a doula, because if you do, she's gonna come over. Prior to your last week, like my doula, we've had sessions in the home where we did exercises together. She showed me how to work my pelvis on the ball. Showed me how to, showed my husband how to do some counter pressure, because when we like to call them waves, because I feel like contraction has such a negative connotation. So when the waves come, we're focusing on how to ride these waves and mentally and spiritually get through them.
Right.
We're really, really over them. So I think it's just such a great support system to have. And then, like Rose just said, when you have a partner, sometimes it can be a little overwhelming, because obviously, like, this is me and my husband's first baby, so we're just out here winging it. And although, of course, he's going to advocate me in every way that he can, having a doula is amazing, because there are certain things that, for example, at my 36-week checkup, the nurse was like, okay, we had my ultrasound, we did a little scan of the baby, see, for sizing and everything. And then she was like, okay, get undressed, they're going to check your cervix. And I'm like, for what? Why are we checking my cervix at 36 weeks? Exactly. And in that moment, I like tiptoed off to the bathroom and I called my doula and I said, hey, I don't know how to articulate why this isn't right, and I don't think that we should be messing with Mother Nature. I had read things before about possible infections and risk, and how even if they check your cervix and see that you're dilated this much, it doesn't mean anything, because that's just where you are in that moment. But I just didn't know how to articulate it to the head nurse and to my OB, and I didn't want to come from a standpoint of like emotion, because as your hormones are going, and I felt like going there swinging like, you're not going to check my cervix. So my doula was able to just talk me through it. She sent me like some quick talking points, and like an article I could read real quick. And I was literally just on the phone with her. So when I walked back in fully clothed, my OB walks in, she's like, hey, we're supposed to check your cervix today. Why are you not undressed? And I was able to articulate and advocate for myself in that moment, let her know, you ain't coming up in here. It's way too early for that. We're going to let nature take its course. And unless there's something wrong, like the baby is in distress, there's no need to put a rush on this time clock, you know? So that's just one example of how my doula has been my right hand. And now I'm able to, you know, be super knowledgeable and advocate at all times. But that's just one example. I know you probably have a bunch more.
That's a really, really great example. And I think one of the very important takeaways for our chat today, I would love for everyone who's listening, is to really recognize and own the fact that it's your body and it's your choice. It's okay that my body, my choice. And as you say, to be informed, because there's really no clinical indication, no clinical reason for your cervix to be checked at weeks. Because we know from a clinical perspective, doing a vaginal exam, that could release progesterone and that could actually start labor, right? There's absolutely no need for that. And it's okay. Oh, I didn't realize that vaginal exam was the norm at 36 weeks. Help me understand why that's important.
Mm-hmm.
From that way. And as a provider, why they think it's important, say, you know, thank you so much. That's great information, but I'm going to opt out of that. I'd rather not have that done. And
That
then,
part. Period.
period.
No ifs, and stand on it.
Right.
And I think that's an important thing to, because again, for my ladies who maybe don't have a partner with them, or maybe they'll have a doula, but maybe the doula isn't, you're in a state where the doula is not allowed in the hospital room. It's so important for you to, like you said, do the research, talk with someone you trust, sign up on Antonia Grace. And when you go into delivery, have your birth plan, but also have things in the back of your mind that you're ready to say, where you can, and I know it's going to be a lot, obviously, in labor, but where you can advocate for yourself in that moment. Because I've had, again, so many friends that ended up in predicaments where they felt pressure. Like, I had to say yes to this Pitocin. I had to get induced. And in the reality, you didn't. But it's because of the way things were framed to you. You know, they love that word, your baby's in, the phrase, your baby's in distress. And I feel like once they use those words, it's like a trigger for us. And we hop into do whatever you got to do to save us. And really, some of these things that they're doing, these health providers, it's causing us to go into distress, you know? And they're like on this timeline where they have all these mothers that they're trying to get through. And I really believe that as Black women, we always get the short end of the stick. And it's no coincidence that our numbers for all these issues with birth are so much higher than other women. So I would love for your perspective on that, and how we can be better prepared going into delivery, especially if we don't have a partner or the doula is not able to come in with us.
Right. And again, having information is vitally important, being informed about what is the normal process. You are right. I just had a session, a webinar for some nurses, and quite a number of them attending. And I talked about the whole concept of disrespect. And I also talked about of coercion. You know, I said, let me what you're talking about sounds exactly like coercion.
Yep.
In our practice, in our routine, in the healthcare setting, in the hospital, we're so accustomed to doing things that we don't step back and say, wait a minute, am I being not a bully, but am I trying to coerce someone to have something done? This is the example that I gave in the talk. I said, if a patient comes in, a family, mom says, I want an unmedicated birth. I want to be able to jump in the shower or maybe get in the tub. I want to do all these things. And then we say, okay, well, I need to put an IV in you first. And if you don't agree to the IV, then you can't do any of those things. I said, that's coercion.
Wow.
We have some policies that says that every patient that comes in gets an IV. Maybe they don't have the bag running, but they have the IV
Yeah.
their arm. And what I said to the team, the group of nurses, I said, listen, for somebody who is at low risk, normal risk, they don't need an IV. And want to jump in the shower, if they want to get cool, if they want to sit on the ball or lay down with the peanut ball, and you say, well, you can do all those things after you do this, I said, that's coercion. So it's
Yeah,
for, so I'm a nurse, so I can speak to the nurses. I'm like, it's really important for us to watch our language because our words matter.
sure
And
do.
yeah, we need to really lean into that and make sure that we're not being part of the problem. So yes, maternal mortality definitely is an issue. And I think we've done a really great job amplifying to the extent now that Black women are terrified of coming to the hospital. They're
Yeah.
terrified when they hear that they're pregnant. So I'd rather not lean into that aspect of it because I think it's all out there. It's just a Google away. But
Yeah,
women to know that they have a voice, that their opinion matters,
absolutely.
out and say, help me understand why. Thank you so much for the information. I'm going to opt out of that because I have a plan and I've done my research and I know what I want. So we can do that. And again, having village, your support, because if you're in labor, let's say it's been 12 hours, you're exhausted, you just had an epidural and they're talking about the stress, you need people to come in and be around you and center around you and ask those questions for you so that you can just relax and rest and let your body do what your body knows it can do. So it is important to have people around you. I was speaking to someone recently, a really well-known advocate in the birthing space, and I said,
Mhm.
I really hate saying Black women need to advocate for themselves because it's like saying that the victim needs to advocate for themselves. And it's unfair.
That's
It's
a good point.
we've done that. However, this is our reality. And between our family, the doula, the lactation consultant, maybe your nurse navigator, maybe Antonia Grace, you need to surround yourself with this support group to make sure that you're heard and your desires for your birth experience is what actually happens for you.
Amen to that. Yes. And we had another question about resources that I think Marie asked. So, Marie, I'm so glad you asked that because this platform that she represents has, a wealth of resources. So, for the ladies who are kind of just joining in, if you could touch on, like from the perspective of someone who just found out they're pregnant yesterday,
Yes.
what steps would they take to go on you all's site and navigate it, and what options would they have for support? Let's be in like the shoes of a first time new mommy.
Sure. First time new mommy, just go to link in our bio, right? Go to Antonia. It's a beautiful page. I may be a little biased, but maybe not. Maybe
Like it is.
it's a beautiful page. And if you go to the resources, we have some really amazing resources. We have three blogs that we have, again, beautiful Black women who are experts in their field, talking about things that are super important, like mental health, like your pelvic floor, how to communicate with your provider. That's a really great one because it really arms you and gives you tips on what questions to ask and how to prepare for.
Mhm.
And we have other resources, other downloadables on there. So we want to try to be one-stop shop for women as it relates to birthing. So lots of really great resources on our page, and of course, it's on the page. Everything is super free. Information is free. And anyone can always reach out to us and ask questions for free. Doesn't mean that if
Okay.
go to, info at Antonia Grace, it doesn't mean that, oh no, we're not going to talk to you until you do this. Absolutely. At the end of the day, I want everyone to have a birth that's sacred and joyful. I want to have maternal morbidity and mortality. I want Black women to feel empowered. At the end of the day, that's what I want. That's a win for me.
Yes. Thank you for that. And with women who obviously are in different states, like in my audience, they're all over the place from Texas, New York, Cali. I know with you all's a concierge service, do you provide like maybe a list where you can help people get matched to doulas in their area, or can you talk a little bit about that?
So we are headquartered here in Atlanta, Georgia. How we can offer services anywhere in the United States. We
Okay.
that's designed especially for women who don't live in the state of Georgia. And that is definitely one of our goals as well to connect them. But the tier is because our nurse navigators live all across the United States.
Mm.
That is absolutely what we do, is that we connect you with a doula that is close to you. We help you with the interview process to make sure that you select the doula that really resonates with you and has that value congruence with you, because birth is too important not to make those decisions. So
Absolutely.
yeah, we definitely can help any woman in the United States.
Awesome. And then let's say I'm already in my third trimester. Yeah, I missed the mark. Because we have some ladies on here who were like, I don't even know what a doula is. Is your site, your platform still something that they should seek out? Like let's say they're giving birth in 3 weeks. Is it too late?
It's not too late.
Okay, okay.
Go ahead and reach out, and we will work tirelessly to connect with a doula. There's
Yeah.
there's a lot of doulas out there. I feel so thankful for the time that we're living in, because
Yeah.
doulas are like popping up everywhere, and I love it. It's just about connecting women with doulas, but they're out there, and there's some great resources.
Good. And I have another question. And ladies, we're gonna wrap up soon, but please drop your questions in the comment box because I want to make sure we're answering them. Joy has another question. She said, "Is there any provider who can help with making the home sacred and joyful for the arrival of a baby, or would that be included in the role of a doula?" And from my perspective, and I'll let Rose talk about that, but for me, our doula, she has definitely come into our home 3 times already for 3 different sessions, and she's helped us with just small things like, prepping the home, reminding us, hey, you need to make sure you're meal prepping, and just the little things that we probably would forget as newborn parents. And then she also is going to come back. Well, she's going to be with us for laboring at home because I plan to labor at home as long as I can. She's going to be with us in the delivery room. Then she's going to come back for some postpartum visits, which is super important because she has a team with a lactation specialist who I'm actually going to meet with on Monday,
Mm-hmm.
who's going to go over breastfeeding helpful tips with me. And then they're both going to come back after baby's at home just to help me with, life, and to make sure, like, well, is she latching? Did she not latch at the hospital? What happened? Just to talk me through it. And then as far as like setting the ambiance and everything, absolutely. She's already helped my husband and I so much with creating what we call an environment of oxytocin. So last time she was here, she was showing us, during the early labor phases, you guys should dance. And at first we felt kind of silly, but it was really sensual, and not in like a weird way, but we were literally just kind of cuddled up. And she was like, explaining your baby can feel it. And the more oxytocin environment, the more the babies want to come out. So again, I can't speak highly enough about the importance of a doula. And I just want to encourage all of you, whether you are in your last trimester, you just found out yesterday, or you're planning ahead, do your research. Obviously, sign up on Antonia Grace to get some support, and get yourself a doula. But I'll let you speak upon what your experience has been with seeing doulas and how they can help prep your home or help you in your home environment.
Yeah, they can absolutely help with that. And I love your question about, how do we create that sacred and joy? I think it starts with you, right? It's like my my vision for my birth is that birth will be sacred and joyful. Make that your words of affirmation. Put
Mm,
it every day, and manifest it, because we have
yes.
the power to manifest that. And then share that, articulate that to the provider. I am super excited about a sacred and joyful birth. And a really good provider will say, tell me more about that. What does that look like? Oh,
Mm-hmm.
well, it looks like me making sure that my voice is heard, that we're not doing any unnecessary interventions, that, people protect my privacy, they knock before they, just be as specific as you want. What is sacred, joyful to you? So you manifest that, you do that. And going back to the doula, yes, it can't be overstated, the importance of having the doula as part of your experience. As Shay, you're cracking me up at your environment of oxytocin. Um,
Yeah.
First really help as
Oh,
having warm water to your nipples, because that, the stimulation to your nipples creates, releases oxytocin. So there's
yeah.
really great things that you can do to prepare for that that experience. And I know that your labor is going to be awesome sauce, but know that you have enough yours. If you have any questions or any way that we can support you at Antonia Grace, it would be our pleasure to do
Oh,
that.
thank you. Thank you. I'm gonna take two more questions, ladies. Christina, hey Christina, hey Ken. She said, excuse me, she asked, are there any resources on your platform for women who are experiencing postpartum depression? That is an amazing question. Thank you for asking that.
That is a great question, and I didn't get into that as much. I talked about pregnancy, labor, and birth being normal, so that we have holistic support. In our network of holistic support, these are the people who partner with us. We have acupuncture. We have a physical therapist that focuses on the pelvic floor, so pelvic floor physical therapist. We have massage therapists because why not? Uh,
Yes.
we have counselors and mental health experts. We definitely advocate that for every woman. Part of our the Antonia and Grace process is that at every interaction with a navigator, we have you do this assessment. It's called a PHQ-9. It's 9 questions to ask about where are you right now. And based on results, because it'll tell us you need an intervention with a mental health specialist or you're fine. We think that is super important. So we have an integrative medicine as part of our resource because not everyone can spontaneously get pregnant, right? And not everybody wants to do infertility. Some people want to try the holistic route, and a functional medicine physician or integrative medicine is amazing because they can look at you holistically. What's your hormone balance? What is your weight? What can you do to help you prepare for pregnancy? So all of that is part of our network because again, we want your pregnancy. We want you to have all the resources you need, and it's not about drugs and intervention. It's about other ways to support you holistically.
Absolutely. I love that. Thank you for sharing that. And we have Ash, the boss. Hey, Ash. She said, do you have any tips for a transfer? Oh, this is a good question. A transfer of care conversation with your current provider. This is a good question because I was talking to somebody recently and they're due in like 4 weeks, less than 4 weeks, and they transferred care providers like that and had no remorse. No, and that is exactly how I feel because this is not about the care provider, the doctors and nurses. It's not about their feelings. I'm pretty cut and dry. So if it was me, something goes left, I wouldn't even go back. I would have a quick conversation. Hey, transfer my files to this. Matter of fact, I might even just ask the new doctor to reach out for me and get the nurse to do it because I feel so strongly about that. And Rose is probably a little more graceful in her response. But I'm gonna tell y'all right now, when it comes to you and your first, second, third born, don't matter how many kids you got, that's your sacred journey. And if you have a provider that has given you some type of bad vibe, you trust your gut, sweetheart. Don't look at it from a personal aspect. It's business for them, but for you it's motherhood, and you have to trust your instincts. So if something goes wrong, I don't care if you are due in 4 days, it is never too late. And I want you all to have confidence and go into that conversation, or not. You don't even have to have a conversation, there's ways around it, but always put you and your unborn child first, and don't have any regrets about it, and be unapologetically ready to walk out that door. But her answer is going to be a little more professional and graceful. So you got the ratchet side. Let me give you the professional side. Go ahead, take it away.
There's we're gonna be. So no, you are absolutely right. I do want to caution that there's two sides to the story. There's two sides to the decision, not the story. If you decide that you want to transfer care, you have to be able to find a provider that will accept you. There are some providers that say, "Oh, if you're past 36 weeks, absolutely not,"
That's
because
true.
haven't been with you. So you're going to have to do your research to find somebody who's willing to accept you. But I agree with Shay when she says to trust your gut, because if this is happening prenatally, what's going to happen when you're in labor? So ask some questions and say, you use your words, say, I feel like I'm not being listened to. Let me give you an example of why I feel like this. Because when, be explicitly clear, and then give your provider a chance to say, oh my gosh, that's totally not my intention. I'm so sorry. Or this get over yourself. And if they say get over yourself, say, I feel like this relationship is not working and I'm going to be looking for another person.
Absolutely.
I'm out of here. So you can have the conversation, but I just want to caution you that not all providers, many providers, if you have your prenatal records, if you say, I've had prenatal care, it's all documented. I just cannot work with this provider. Many will accept you, but not all, because sometimes they feel like it's liability because
Yeah,
the ones that cared for you, they didn't ensure that you had the appropriate labs and the appropriate ultrasound. So, a
that's true.
word of caution.
No, thank you for bringing that point. Oh, this is so good. Okay, one more question. Sorry, it's so good. I don't want to hold you up, but
Your
this is a
fault.
really good point. Janelle said this is her third pregnancy. Hi, Janelle. It's her third pregnancy, and she
Congratulations.
didn't have a doula for the first one or the second one, and she feels like it'll be going backwards to get one for the third pregnancy. But absolutely not, Janelle. And anyone else on here who feels like they're behind, you are not behind. I want you all to know that just like when I first got on here, I said, I only have one friend out of a bunch that had a doula. Y'all have to give yourself grace and know that the resources we have now with technology, social media, a lot of that didn't exist when you all first had your first or second pregnancy, maybe even 3 years ago, maybe even 2 years ago. So always be open about seeking knowledge and, understand that motherhood is an ongoing journey for life. You can continue to learn things. It's never too late to seek out support and help,
Mhm.
whether it's finding a doula and support through Antonia and Grace, or if maybe locally you have a friend that referred you, or maybe you just hop on Google. Please don't ever think that you are quote unquote playing yourself, because that's what she put in her comment. You're not playing yourself. If anything, you're doing what's best for your third child, and also for your first and second children, because at the end of the day, that's a part of your village, whether they're 2 years old or 20, because I'm not sure how old your children are. This is knowledge that you can pass on, especially if you have daughters. So you remember the back in the day, the little reading rainbow, the more you know. That's my motto when I think of things like this. The more you know, the better. So don't feel bad that, you feel like you missed out. No, the past is the past. Let's move forward and use these resources that are available to you. And you can chime in and give your perspective as well.
I absolutely agree. You used a great quote. I was thinking about Maya Angelou, when we know better, we do better. So you're not going backwards. And don't forget, every labor is unique. It's a whole different experience. So now that amazing resource, yeah, bring it on. And that's what we say, at Antonia and Grace. It's like, it doesn't matter which pregnancy. It's not just for the first time mommy. We love
Yeah.
all pregnant women. If you just found out and you have, four beautiful kiddos at home, yes, why not go ahead and be pampered in this fourth pregnancy because it's available to you. So
Yeah.
go forth with the doula, and you'll be glad that you did.
Yes. Okay. I think it's so good. All these good questions. We'll end on this note. If you had one, I know there's so much advice you could give, but just one like key token umbrella of advice, like one good takeaway that our current mommies, our future mommies, our pregnant women on here, just one piece, what would it be? Like your final thing?
I think my final thing would be to trust yourself, to know
Mm.
you're worth it, and you deserve to be treated with dignity and respect, and you deserve a safe and joyful birth. So trust yourself, speak for yourself, believe in yourself.
Amen. I love that. Thank you so much for coming on here. Again, as a reminder, ladies, please click the link. First of all, follow Antonia and Grace. Go ahead and follow her now. Follow the page, the platform, and make sure you all go on the website, especially if you are because the headquarters are in Atlanta. So if you're and that's not just servicing Atlanta, it's Georgia, but then some, because
Correct.
you have what you call, I love that, nurse navigators all over. So please, you all, go to the platform. Let's uplift one another. And if you know somebody, maybe right now you're not pregnant or you're not thinking about it, but if you know somebody, please send them her page so that they can have that resource. And let's just create a pipeline, whether it's your cousin, auntie, best friend, sorority sister. We need to get the word out, because women of color, I mean, the work is being done, but we have so much more to do. So it starts with us, because if we don't look out for each other, clearly who will? So I thank you so much, Rose, for joining. You are welcome back anytime.
I,
And in another 10 days, hopefully get my body back and I can bounce back on here and talk with you some more.
I love it. Whenever you want, I'm ready.
Yes. Well, thank you so much. And ladies, if you all have questions, if okay with you, Rose, maybe they can send you a DM, or actually, no, go to the site.
Go to the site.
Go to the site, no DMs. Because I know that there were a lot of questions I have like a question box here that I couldn't get to. But please go to the site. There are nurse navigators on standby waiting to help you all, waiting to offer the support. And we will definitely have her back again when I'm like probably in my postpartum journey so that we can talk more and get into this mommy chat. Thank you so much.
Thank you.
Yes, it was so nice having you. Have a great weekend, y'all. Bye.
Bye.